Communication, nutrition, and health assessment factors of the aging. The need to communicate, to be listened to, and to be heard does not change with age or impairment. The need to communicate and the need to be treated as a person will remain despite memory and/or communication impairments. Care and communication that respect and value the dignity and worth of every person, including those with cognitive impairment, will enhance communication and personhood. On page 47 in your book, box 4.3, is some examples of Elderspeak, where younger people will actually alter the way they talk based on the assumption that all older people are going to have problems with understanding or comprehending the communication. Basic communication strategies are going to include attentive listening, authentic presence, in other words, be there, non-judgmental attitude, cultural competence, clarification, giving information, seeking validation of understanding, keeping focus, using open-ended questions. Due to larger life experiences, the older adult may require more time to gather their thoughts. Their word retrieval might be slower, especially for nouns or names. Open-ended questions can be useful, but they might be difficult for some elders. Closed questioning may cause the elder to feel like they're put on the spot. Position yourself physically at the client's level. And clarify using generational, cultural, and regional differences in speech patterns, or realizing that these things can cause misunderstandings. Aphasia is usually caused by a stroke or a head injury, but it could also be caused by brain tumors, infection, or dementia. Documentation requirements are going to vary with the type of care that is provided. For example, in the skilled nursing facility, you have to complete a resident assessment instrument, which can include a minimum data set or an MDS, a resident assessment protocol, and resource utilization groups. In home care, then we are looking at doing the OASIS, which is the Outcomes and Assessment Information Set. Looking at nutrition, we have to consider eating habits, making sure we include cultural or ethnic-based dietary choices. Nutrition can be affected by a variety of things, and we need to be very careful in our assessment, making sure that we are looking at all issues regarding nutrition. When we're assessing the older adult, we realize that this assessment can be more complex. It's more detailed and it can take longer to perform. And it must be paced according to the stamina of the nurse and the client. The assessment requires the ability to listen patiently. Make sure you allow for pauses. Ask questions that are not often asked. Obtain data from all available sources and recognize normal changes of aging. During the assessment, also look at caregiver stress or burden and cultural and spiritual assessments. In completing the physical assessment of the older adult, try using the mnemonic FAN capes. F being fluids, or the current state of hydration. Are they able to sense thirst and able to obtain, swallow, and excrete fluids? A being aeration. Are they able to maintain oxygen saturation of at least 96% in most situations? Do they require supplemental oxygen? Assess their respiratory rate and the depth at rest and during activity, and assess their breath sounds. N is nutrition, mechanical and psychological ability to obtain excuse me, and benefit from adequate nutrition? What is the status of their oral health? Are they taking an appropriate diet? C is communication. Is the client able to communicate needs adequately? Can they hear? Do they have aphasia? What are the client's reading and comprehension levels? Activity. Is the client able to perform their ADLs? Do they require assistance? What is the client's coordination, balance, ambulatory skills, finger dexterity, and grip strength? Pain. Is the client experiencing physical, psychological, or spiritual pain? Are they able to express pain? And how do they obtain pain relief? Elimination. Does the client experience problems with bladder or bowel function or control? Do they have adequate and accessible facilities? Do they require assistive devices? And does the client's elimination patterns affect the client's social functioning? And last, socialization and social skills. Is the client able to negotiate relationships? Is the client able to give and receive love and friendship and feel self-worth? Just because a person is older does not automatically mean that they are demented. Don't forget to look at the entire person if there is a change in mental status. What medications are they taking? Have they just undergone a procedure? Are they having pain? Is there an infectious process going on? Assess the social support system and their environment, and assess the functional abilities. Are they able to complete activities of daily living? Do they need assistance with the instrumental activities of daily living, such as house cleaning, shopping, or managing their money? Tools that are used to assess activities of daily living can include the CATS Index, the Barthel Index, and the Functional Index Measure.